Good day, I am Princess Sheila Jane Vidal from BSN 111. And today I'm going to perform a parenteral drug administration return demonstration using the subcutaneous and intramuscular injection. Prior to the conduct of the procedure, the first thing to do is to check the doctor's order on the patient's medicine administration record, which is done to identify what kind of drug to be given to the assigned patient, identify the drug's name, its dosage, routes of administration, and time it is to be given. Now we also need to follow the 3 checks for administering medications. Read the label on the medication, 1 when it is taken from the medication card, 2 before withdrawing the medication, and 3 after withdrawing the medication. To prepare the medications, we need to have syringes. So I have an insulin syringe for the subcutaneous injection and a 23 gauge syringe for the intramuscular injection. I also have aspirating needles, and we have sterile water, which will serve as the medication vial used in this demonstration. Of course, we also have a medication ampule. I have a gauze pad, a alcohol prep pad, and cotton balls, and most importantly, the waste receptacles to dispose of used needles and syringes to avoid needle injuries. After gathering the equipment needed, I'll perform hand hygiene to deter the spread of microorganisms and avoid cross-contamination. Now for subcutaneous injection, we will be preparing medication from a vial. First, we'll have to read the doctor's order and compare the medication in hand. Now, to prepare for the medication for subcutaneous injection, we need to open the insulin syringe and take it out. And remember to only touch the barrel and the plunger of the syringe to avoid contaminating the needle. If the syringe is capped, then remove the cap first because we'll have to connect the syringe into the aspirating. And now secure and sure connection is in place. Set it aside, then open the medication vial. Now that the rubber seal of vial is exposed, clean the surface of the rubber seal using the alcohol prep pad and do this for at least 30 seconds. Now take and uncap the syringe and draw into the syringe, drawing air just with the exact amount of the medication ordered by the doctor. Now drawing air just with the exact amount of the medication ordered by the doctor. Now inject the air into the vial. Now invert the vial and draw the medication up to the exact amount needed. If there is an air bubble, then slightly tap the barrel. Now we remove the aspirating needle and place it with the right size needle that will be used in the actual administration of the medication. the aspirating needle used in a waste receptacle to avoid needle prick injury. And write the medication ticket, name of the drug and dosage so that we won't forget what medication was drawn into the syringe and we won't get confused. Now for intramuscular injection, we will be preparing medication from an ampule. I'll just perform hand hygiene first to deter the spread of microorganisms and avoid cross-contamination. Now first we'll have to read the doctor's order in the MAR and compare the label on the ampule to make sure that it is the right medication being prepared. Now prepare the medication ampule for drug withdrawal. Inspect it and make sure it has no crack. Next, I'm going to lightly flick the upper stem of the ampule several times with a finger. Take the alcohol prep and clean the neck of the ampule to help prevent contamination and let it dry. Now, while waiting for it to dry, we'll get the syringe and replace it with an aspirated needle. Now secure and ensure that it is tightly tight. Now it's time to break open the ampule. Take the clean gauze and wrap it around the head or neck of the ampule. Now break off the top by bending it away from our body and away from others. Now dispose the broken piece of the head and neck to the sharps container as well as your gauze. Now we're going to withdraw the medication from the ampule. This time we don't have to inject air or inside the ampule. Make sure that the ampule is on a steady, flat surface using your fingers to hold it. Now we're going in and withdrawing the prescribed amount of solution, so the doctor ordered 1 cc of medication. Now remove and turn the syringe upright and flick it to get air bubbles out. Push up the plunger slightly to the prescribed amount and then remove the aspirating needle and dispose of it to the sharps container. Place it over the medication tray until ready to administer the medication. Also write the medication ticket, name of the drug and dosage so that we won't forget when medication was drawn into that syringe and we won't get confused. Now place it on the medication card.